A very good morning to all. Today we will start with the disorders that we have discussed in the previous lecture, that is a breast cyst. Next, here we will discuss regarding the fibrocystic breast diseases. Okay. So both they are almost like a similar, but they are different from each other. So fibrocystic breast disease. Okay. Uh, This is a normal diagram of the breast. Okay, here the lobules are there, tissues are there, ductus will be there, and if this is a fibrocystic, then these lobules they will become like this. There will be increased size in the this lobules. That is a fibrocystic breast disease. A fibrocystic breast disease that is commonly called a fibrocystic breast or fibrocystic changes. It is a benign, means they are non-cancerous condition in which their breast they feel very lumpy. The fibrocystic breast they are not harmful or they are not dangerous, but it may be bothersome or uncomfortable for some women. Okay, so remember the definition. They are fibrocystic breast or fibrocystic changes, and they are benign, means they are non-cancerous, in which the breast they feel very lumpy. Causes: the exact cause of fibrocystic breast changes it is not known, but some experts suspect that the reproductive hormones, especially estrogen, they play a major role. This cause is the same in the breast disease, that is excess level of the estrogen. Fluctuating hormone level means there is alteration in the hormone level during the menstrual cycle. It can cause a breast discomfort and areas of lumpy breast tissues that feel very tender, sore, or swollen. And fibrocystic breast changes it tend to be more bothersome before the menstrual period, as and the pain and lumpiness tends to be clear once the menstrual period has been begins. So this is same as we have discussed, that before the menstruation it will appear or it will start developing, and when the menstruation is over, when the period has been started, it will be relieved or it will be started subsiding. Risk factors in that: faulty diet, hereditary, and bad habits. In the faulty diet, if the women they are taking a diet that is very high in the fat and excessive caffeine intake, then it will be considered to make a condition worsen, and it will be a risk factor. Next study is a hereditary, means it will be passing from generation to other generation. Next, if the patients they are having any bad habit like smoking, alcoholism is there, other faulty health measures, if they are having, then it can also be a risk factor for causing the fibrocystic breast disease. In shorter, it is known as FBD. Although many women with fibrocystic breast don't have any symptoms, but some women they experiences breast pain, tenderness, and lumpiness, especially in the upper outer areas of the breast. If you feel that the upper outer areas of the breast that is very closely connected with the arms, so that will a main sign by which identification of the fibrocystic breast is possible. Next, other sign and symptoms: breast lump or areas of thickening that tend to blend into a surrounding breast tissues. Means there is a filling of the breast lump, generalized breast pain or tenderness. Means the whole breast is feeling pain and uncomfortable and it will become tender. The breast lump. that fluctuates in the size with the menstrual cycle. As we have know that before the menstruation it will be larger and after it will be reducing. Green or dark brown non-bloody nipple discharge that tends to leak without the pressure or without the squeezing. Means there are chances of the nipple secretion. Breast changes that are similar in both breast. Monthly increase in the breast pain or lumpiness from the mid-cycle, that is, at the time of ovulation, the symptoms of pain and lumpiness will be higher just before the menstruation. So these are the um, common signs of the fibrocystic breast. In that, breast lump, areas of thickening that will be glands, generalized breast pain or tenderness, breast lump, the size will be fluctuation, chances of the green or dark brown non-bloody discharge. Breast changes, they are similar in both the breast and monthly increase. The breast pain or lumpiness at the time of the ovulation. Next, what are the managements of the fibrocystic breast? And the fibrocystic breast, in that the management first it is relief of the symptoms. Okay, means the symptomatic treatment that is given to a patient. And second one is the hormonal therapy. In the relief of the symptoms for the pain, anti-inflammatory medications including acetaminophen or non-steroidal anti-inflammatory drugs they are given to reduce the pain. Next, some basic that avoidance of caffeine, chocolate, elimination of the excessive fat, limitation of the salts, and increased dose of the vitamins. Other supplements they are given, that is vitamin C, vitamin E, vitamin B6, vitamin A, and others. Second one, that is a hormonal therapy. Hormonal therapy is given for the severe symptoms. So for severe symptoms, the doctor may prescribe a hormonal therapy such as birth control pills, that is Maline and Maladine, then Danazol and Bromocriptine. This is containing the hormones and they will regulate the estrogen and progesterone level inside the human body. So hormonal therapy is given. Diagnosis is same like breast cyst, but here the cyst, fibrocystic breast that is examined with the same, that is examination, mammograph, ultrasound examination, and a nipple aspiration. Okay. So that is all about the fibrocystic breast disease. This is a very small topic but is important. Next topic, that is a breast cancer, but it is already taught to you by Ankita madam. So we are not repeating and we are skipping that topic. That is a breast cancer, but it can be asked. Hmm. So that is all, and this topic is been finished.